3 new COVID cases have been recorded overnight. Victoria is on the verge of going into a deeper and more prolonged lockdown. Contact tracers appear no closer to finding the missing link cases, and the number of infections are expected to grow just by 3 today, as we've seen the numbers just drop. This is Victoria's 4th wave. For those in aged care, it is particularly daunting. In Victoria's last outbreak, 655 aged care residents tragically died after being infected with COVID. At that time, staff working in multiple facilities was identified as the issue, and it's happening again right now. The Health Minister was asked to explain why yesterday afternoon.
Sorry, Minister, it sounds like there are faceless people making this decision, which could be fundamental to the lives of people in aged care, residential aged care facilities.
It remains critical that people are able to work for vaccinations, for testing, for surge workforce, all of those things that are occurring.
So we're just trying to clarify though, what is the reason why, when community transmission started to occur, it wasn't immediately changed?
So again, this is based on the medical advice of what is the appropriate time and that was laid out by the Chief Medical Officer in the declaration of a Commonwealth hotspot on Thursday.
Based on the medical advice, according to Greg Hunt, residents and staff still have not been fully vaccinated. It was meant to happen in March. We are now in June, and still we can't really get a hold of how many staff and residents have received 2 jabs. The federal government keeps on giving us the number of facilities that have started the vaccination program, which means nothing when we talk about the number of residents and staff. 2 weeks ago, the Prime Minister said this.
We've made particularly good progress in aged care facilities. We're through about 85% of those now and on track with completing that in the timetable.